Hello, everybody. Thank you for coming to my talk. This is going to be a little bit different talk from the previous ones because I'm going to focus a lot also on the measurements and giving you an example of the medical devices that we've been developing. And being in a hospital, I'll give a little bit my perception of medical device development from hospital point of view, and try to also deliver the idea that quite often is very challenging to have clinician accept your products. And so that's why sometimes the testing has to reach a point that it has to be extremely high quality for them to be able to accept your product. And so in this case, EEG-fMRI has been around for almost 30 years, and yet we don't have yet a system that has been accepted by the clinical day-to-day workout. And if you think about imaging compatible EEG, we're talking about an EEG cap, an EEG system, and it could be a PET, MRI, and MEG, but mostly here I'm going to be talking about MRI. And obviously, EEG has a lot of clinical application from epilepsy, seizure disorders, etc. And both modalities contribute to this diagnostic power. And so yet having the combination of two at the same time would improve the tool even further. The biggest market is actually neuroscience, and that's where there are thousands of papers, studies every year about EEG with different types of studies. I'm going to present one with sleep. And but there are also hundreds of studies in which people do EEG-fMRI at the same time or simultaneously. The reason why they do that is that each modality has some limitations. So MRI is very good to look at the inside of our body with very high spatial resolution, but has a very poor temporal resolution. So putting together these two modalities, you can reach higher temporal and spatial resolution. So now we work a lot with high-density EEG nets, because it can give us power also to localize sources in the brain with higher spatial accuracy. However, the commercial EEG caps rely on metal wires, and these metal wires, as I'll show you next, produce artifacts, which we call them susceptibility artifacts and RF inhomogeneities, and also can focus the RF. So the RF is used in magnetic resonance imaging to capture signals from your body and reconstruct the image of your body. And so this RF can be focused on spots and produce local heating, which we call the antenna effect. And so these are images taken from our PAC system at a Massachusetts General Hospital from normal patients wearing EEG. And as you can see, these are standard clinical images. And you can see that part of the brain is completely cut off by the presence of the electrode. So the other thing is the Food and Drug Administration is kind of limiting the amount of power that we can deliver to our patients. And if we talk about the whole head power, it's limited by a constant, which is called the specific absorption rate. It's nothing else than the normal power. So sigma C, which is a conductivity, divided by 2, multiplied by the electric field amplitude square. And this is normalized by the body mass. And so what is this 3.2 mean in practice is just basically the FDA doesn't want that our patient heats up more than 1 Celsius. If you think about, laying in the sun on the beach, it's quite often, it's quite possible that your temperature